Hi, it's Dr. Svehlak. In my office, I get a lot of patients that come in and are concerned about the type of anesthesia they may undergo during their procedure. Some are, quite anxious about getting general anesthesia and being totally asleep. Many times my patients will ask me if a certain procedure can be done under a local anesthesia. What I want to tell you a little bit of difference about what local anesthesia is and what general anesthesia is. Most traditional surgeries are done under general anesthesia. That means we're in the operating room, we have an anesthesiologist involved, you go completely asleep under heavy IV medications where everything is monitored, your vitals, your breathing, and even with a breathing tube in your throat. Many patients, find that very invasive and would prefer something less so. Local anesthesia, on the other hand, is done awake. We're in the office. Usually a patient is given a little bit of oral sedation, such as a pain medicine and maybe a benzodiazepine, helps them relax, feel comfortable, feel chill, and then the procedure is done that way where they're pretty much awake the whole time. Local anesthesias are usually done for surgeries that are much shorter, usually maybe a few hours. General anesthesia is typically done when patients are going to need anesthesia for multiple hours. Typical procedures that can be done under a local anesthesia: small area liposuction, say under your chin, or the arms, or part of your tummy and the sides. Other types of procedures: otoplasty, pinning the ears, upper eyelid surgery. Sometimes I do lip lifts under local anesthesia. Sometimes even minor rhinoplasties. Is also a mini BBL where small areas of liposuction are done, and then that fat is processed and then injected into the buttocks area, or even if it's for a breast augmentation. And occasionally I also do facelifts under local anesthesia if the patient is willing to undergo that type of anesthesia for maybe 3 hours. As I said before, general anesthesia is typically for patients undergoing much longer surgeries, such as full body 360 liposuction, breast lifts, breast reductions, even breast augmentations, mommy makeovers, tummy tucks, and even more invasive facelift surgeries. Typically, after a local anesthesia procedure, patients feel pretty good to kind of go home right away. There's no real recovery. They typically cannot drive home. They need a ride, usually arranged beforehand. With general anesthesia, there is at least an hour to a couple hours in a recovery room being monitored by nursing to make sure the anesthesia wears off appropriately. And then at that time, they are well enough to then leave the facility. So if you're thinking of a certain procedure you may want, but you're not sure what type of anesthesia, or you have concerns about the type of anesthesia, I think you should make an appointment, come in, consult with me. We can discuss the options, and I can give you what I feel is best for you, that's safest to get through the surgery, to give you the best experience you can. Thanks.